Hola, imagine you are managing diabetes perfectly. You take your medication or insulin exactly on time, but then life happens. You get stuck in a meeting, caught in traffic, or simply forget to eat. Missing or delaying a meal is actually the single most common cause of severe low blood sugar. When your body has a medication to lower blood glucose, but lacks the food to balance it, your blood sugar levels can tank rapidly. Today we are breaking down the official medical guidelines on how to identify, prevent, and treat the absolute extreme end of this condition, a hypoglycemic coma. To understand why this happens so fast, we have to look at how your brain uses energy. Most cells in your body can use fat or protein for fuel if they have to. Your brain cannot. It relies almost exclusively on glucose. Even so, your brain is only about 2% of your total body weight. It consumes roughly 20% of all the glucose circulating in your bloodstream. Now, let's add insulin to the mix. Think of insulin as a key that opens cell doors to let glucose inside. When there is too much insulin in the system, or not enough food to match it, insulin rapidly forces glucose out of the bloodstream and locks it away inside skeletal muscles and fat cells. This leaves the bloodstream empty, leaving zero glucose for the brain's transport system to pick up. When the brain runs out of glucose, its electrical activity begins to shut down, eventually leading to a coma. Before a patient loses consciousness, the body sounds a massive alarm. We divide the clinical picture into two distinct stages of symptoms. Stage 1, adrenergic or autonomic symptoms. This is your fight or flight response. The body releases adrenaline to try and force the liver to release stored sugars. You will see profuse sweating and cold, clammy skin, trembling or shaking, tachycardia, intense sudden hunger, and anxiety. Stage 2, neuroglycopenic symptoms. If the sugar isn't replaced, the brain begins to starve. This shows up as dizziness and blurred vision, confusion, slurred speech, or erratic behavior, seizures leading directly into an unresponsive coma. If you find someone in a hypoglycemic coma, time is everything. That time is everything. The treatment depends entirely on whether they are conscious or unconscious. Because a coma means they are completely unresponsive, we must follow strict emergency protocols. Immediate, call 911 or your local emergency number right away. Verify the person is unresponsive. Never attempt to pour juice, liquid, or food into an unconscious person's mouth. This will block their airway and cause aspiration into the lungs. Within 1 to 2 minutes, if an emergency kit is available, administrate 1 mg of glucagon subcutaneous or intramuscular. Alternatively, use a nasal glucagon spray if available. Glucagon signals the liver to dump its backup supply of glucose into the blood. Upon emergency arrival, paramedics or hospital staff will establish intravenous access and administrate a bolus of concentrated IV dextrose, followed by a cutaneous infusion of 10% dextrose to stabilize blood sugar levels. Once the patient is stabilized, medical professionals must run a few immediate investigations to confirm the diagnosis and ensure no other underlying conditions are at play. The first is finger stick plasma blood glucose test, the absolute gold standard first step to check exact blood sugar levels. The second is serum electrolytes and kidney function test to ensure there are no metabolic imbalances or renal failure altering medication clearance. And finally, continuous glucose monitoring. If the patient wears a tracker, downloading the data helps identify exactly when and how fast the crash occurs. While most people recover completely if treated quickly, prolonged or recurrent hypoglycemic comas can leave lasting damage. Potential complications include 1. Neurological damage. Brain cells dying from prolonged glucose deprivation, which can manifest as memory deficit or cognitive decline. 2. Cardiac arrhythmias. The massive spike in adrenaline combined with low potassium during a crash can trigger dangerous heart arrhythmias. And finally, trauma. Physical injuries sustained from falls or accidents when the patient originally lost consciousness. Hypoglycemic comas are frightening, but with quick recognition of the early warning signs and understanding the critical role of never putting liquids in an unconscious mouse, you can save a life. If you found this breakdown helpful for your studies or general knowledge, hit that subscribe button, drop a comment below, and I will see you in the next video. And we have more comas videos. Adios.